Let's get started. Thank you all for joining our second Acromegaly support webinar, built for patients by patients and supported by Acromegaly.care. Today you will be hearing from Casey, an acromegaly patient from Utah, who is here to talk to you about how he has managed acromegaly as a chronic condition. Also joining us today is Lisa Mitchell, a research coordinator at Western Endocrine in Santa Clara, Utah. Lisa is here to give her perspective on managing acromegaly and to provide helpful tips for coping with this chronic condition. Please note, Casey and Lisa were paid a fee for their participation in this webinar by Chiasma. This webinar is being recorded in order to be posted to Acromegaly.care for future viewing. Please note this webinar is for educational purposes only and is not intended to provide medical advice. Every individual's medical situation is different, so any questions should be directed to a healthcare professional. After Casey and Lisa present, we have some time scheduled for questions. Please use the Q&A box in the lower corner of your screen to submit your questions on topics that are being covered in the webinar. To minimize any background noise on the line, I have placed all attendees on mute. We will do our best to get to everyone's questions. If you have additional follow-up or need for clarification on anything discussed today, please talk to your doctor or email us at info@acromegaly.care for more information. With that, I'll turn it over to Casey.
Well, good morning from Utah. I feel very fortunate to be able to spend some time with you all this morning. Just to start, my background from a very small child, I've heard that I always had a baseball or football or tennis ball in my hand, and so sports has really been who I am and what I've been from a very young age. And as a result of that, I think it's taught me to be extremely competitive, maybe even a little bit of a fighter in some ways. That being said, my journey with acromegaly began about 15 years ago. My wife and I had been married about 5 years, and we're looking to start a family. And during that time, my wife, Corey, was also enrolled in dental hygiene school. We're learning about a lot of different diseases, rare diseases as part of their training, and she stumbled onto acromegaly as part of her studies. And one day she came home and said, "I think you might have acromegaly." I kind of giggled and laughed and thought she'd certainly spent too much time reading textbooks, but the signs were all there. I had wedding ring had been cut off 3 times. I had shoes that didn't fit anymore. My bite had changed, and I had an appliance that I wore at night that no longer fit. So the signs were there, but again, we sort of laughed it off because we thought it was just her reading too much into the textbooks. We spoke with a friend of ours who was a physician's assistant and talked about acromegaly, and he said, you know, you very well could have some of the signs of acromegaly, but it's very rare, and I don't know that you would have something like that. But happy wife, happy life, and so I went to the doctor's office as requested by my wife, and we spoke with our general physician, and we wanted to do a blood test to rule out acromegaly. He said, absolutely, we'll do it. So we did the blood work, and the next morning, Dr. Thompson called me on the phone and said, you need to come back in. We've done something incorrect with your blood. Your labs are really elevated, and I know that they couldn't be accurate because they're so high. So we went back in the next day, and we did blood work, and immediately they ran the results, and they were very accurate with the previous day, and so all the signs of acromegaly and the increased growth hormone were there in the blood work. That's the day I met Dr. Grua. He's an endocrinologist from Salt Lake City. I walked down to a different area in the clinic there, and I'll never forget the day he said, "You've got a tumor." I about fell out of my chair. I am an athlete, and things don't happen to athletes. We're bulletproof and all those things, but we certainly were scared, nervous, anxious. Dr. Grua spent a great amount of time explaining what acromegaly was, what the tumor was. Thank goodness the word benign was involved with much of our discussion. But we started talking about what acromegaly was and what I was facing. So we got things quickly going forward and scheduled some surgery in a couple of months from that meeting, and we began our journey with acromegaly. The one thing that I am very fortunate with is that competitive spirit. You know, I wasn't going to let acromegaly define who I was. I was going to fight and push back the best I could. That being said, you can only push back so much. So there are injections and there are pills and a steady regimen that we have to take care of ourselves. But what we've tried to do is make that routine. I have two beautiful young kids now who love being involved, and my 5-year-old daughter thinks that she's a nurse and she gets to do the alcohol, and my son gets to get the syringes ready. And so we've kind of made it part of what we do, and we've certainly embraced and had some fun with that. And then I really tried to stay active. I feel very fortunate that I live a healthy and fast lifestyle, I guess. Try to play a lot of golf, hike. I referee college basketball. And then I started team roping again, which is probably where I find my most passion with being on the back of a horse. The reason that I've become involved with acromegaly is a friend of mine reached out about 1.5 years ago and talked about his wife's had just been diagnosed with acromegaly. And they had tons of questions, and it really got me thinking I need to be more active and be involved in the community and reach out and help people with questions of what acromegaly is and what our daily challenges and how we cope with this disease. I found it extremely rewarding to be involved and share stories with one another. Going to a seminar in Chicago was one of the highlights, meeting people that are just like me. We live a normal life, but we face some certain challenges. But I want to be a part of the solution. I want to talk to folks and help them understand that acromegaly is a disease I have, but it's certainly not something that's going to define who I am. And that being said, I still have some bad days. I think we all do. Part of that might be that 41 years old, I start to have some joints that hurt a little bit more, and I have to be very careful that I don't say, well, that's the acromegaly that's hurting my joints. I have to really try to push back the negative thoughts, because I think it's just me getting old and maybe too active. But anyway, all that being said, I love being active. I love this cause, and I really look forward to visiting with anybody that may have questions about acromegaly. And I can tell you that, once again, the theme that I've tried to live by is I have acromegaly, but acromegaly doesn't have me. And I live a very normal life, and I feel very blessed and fortunate. That being said, the greatest nurse that I've ever met, Miss Lisa Mitchell.
Thanks very much. Casey's our favorite too. You can probably tell that. I'm Lisa Mitchell, and I also live in Utah. My career started as a research coordinator for pediatric endocrinology at the University of Utah and Primary Children's Medical Center. And in the early years of my career, I coordinated multiple studies for pediatric growth hormone deficiency. So that was an interesting background to come from. My role has evolved, and I'm now a study coordinator for a practice seeing both adult and pediatric endocrine patients. And our practice has a special interest in treating patients with acromegaly. I work with Dr. James Grua, and we specialize in treating patients just with pituitary and thyroid disorders. We've been working together now for over 21 years, and right now we're managing about 24 patients with active acromegaly. Management of acromegaly almost always begins with surgery. This is best done by an experienced pituitary neurosurgeon. Surgery is frequently curative for smaller tumors, but often the surgery removes some of the growth hormone-producing tumor, but not all, and this is not always visible. So if postoperative labs aren't normal, including a persistently high IGF-1 or a growth hormone that's not suppressed during an oral glucose tolerance test, options then become long-term medical management, or in some cases a form of radiation therapy. But if the acromegaly is persistent, patients need to learn to deal with acromegaly as a chronic condition, and that's where we really come in. Establishing a routine for this management as a chronic condition helps compliance, and a large part of my job is helping patients understand the importance of this routine and what it involves. The management plan varies from specific patient to patient, but many parts are similar. In our office, we like to take time and sit down and diagram the pituitary gland, explain how it works, and all of the hormones that it makes. Understanding this helps patients to understand why we check thyroid levels, why we check testosterone and or estrogen with LH and FSH levels, why we check prolactin, why we ask questions about hydrocortisone. This understanding early on can help patients down the road when questions or symptoms arise. And this basic understanding of pituitary function is also helpful for the family. It's important to talk to your endocrinologist about goals for response to medication. There can be side effects from deficiency or from excess pituitary hormones, including too much thyroid, too much testosterone or estrogen, prolactin, or too little or too much hydrocortisone. We want our patients to understand that we're going to screen for these other pituitary deficiencies or occasional excesses all the way through their journey. For example, perhaps the TSH, which is a blood test that doctors most often check, is not reliable in a patient with acromegaly and shouldn't be the only lab checked. This came to mind just last month when we saw a gentleman. He was a new patient to our clinic, and he's had acromegaly for the past 15 years. He's had 2 surgeries and gamma knife and still has persistent IGF-1 levels. And he's also taken replacement thyroid medication for the last 15 plus years. He moved to Utah and began following up with a new primary care provider who reduced his thyroxine dose on several occasions. He kept getting more and more tired, and his primary care physician was only checking a TSH level. Again, a TSH level alone might not be reliable in a patient with known pituitary problems and shouldn't be the only lab checked. Not only do we want to make other physicians aware of these things, but we want you, the patient, to be aware of them so you can help manage your acromegaly. And involving your family members and educating them about the pituitary and what it does and about acromegaly is a vital part of the process. It's especially important because you need to stay motivated to use a costly medication that are typically required for patients with acromegaly. So they're expensive and sometimes hard to administer. Being aware that there are long-term risks of inadequate treatment or no treatment of persistent high growth hormone levels. And the biggest reassurance that I want to give you today is that most of these problems can be minimized with good medical management. Some of these problems include, and I'm not going to go through all of them, but they include cardiomegaly and heart failure. And that's probably the most common cause of premature death in patients with acromegaly. That's why we're going to require or ask that you have echoes, or at least when you're diagnosed, and then intermittently in subsequent years. Colon polyps and colon cancer are more common. So that's why we want you to have a colonoscopy at diagnosis unless you're quite young, and probably more regular than other people have them. Hypertension is common. We want to monitor that. Osteoarthritis is a major concern for day-to-day living and quality of life surveys. As Casey said, it may be just that you're getting older, but we want to track these things, and we want you to understand that they may be more common, and we may have some coping mechanisms that may help you. There is an increased risk of diabetes in patients with higher growth hormone levels or worsening of diabetes that's already there. We want to keep an eye on this. Sleep apnea is common, and a sleep study is warranted. That's why we do them. Headaches are more common, and sometimes these occur prior to a treatment with a long-acting medication for the treatment of acromegaly. Let us know if you're having those, and let's see if we can help. Probably the most important thing, as Casey explained and is a great example of, is to maintain ongoing efforts at a healthy lifestyle. To improve your quality of life, I think that attitude and those healthy lifestyle mechanisms will help you. Although every patient's different, there are tips for working with your healthcare team that can help. Number one, ask questions of your physicians and nurses. We can't help you if we don't know the questions. Another thing we want you to do is to understand and adhere to your treatment regimen. And I think the understanding is key here. If you can understand why we're doing what you're doing and the background behind it, I think it'll be easier to adhere to your regimen. We also want you to express concerns. We really do want to know what's going on in your life and the things that may be part of this and see if we can help. Always ask about additional strategies or new approaches to dealing with acromegaly. We go to meetings all the time. We visit with one another, and there's things that are changing all the time. So we're always learning too if you ask us questions, and it helps us to learn too. And we want you to report any complications. Don't feel bad about coming in and complaining about something. I have patients that actually feel bad about that. We want to hear what your concerns are because that's the only way we feel like we can help. And that's it. So I guess we'll turn the time for questions. Thanks so much.
Yes, thank you. So we invite you at this time to submit questions for Casey and Lisa. Please remember that every individual's medical situation is different, so any treatment questions should be directed to your healthcare professional. You may continue to submit questions while the Q&A session is in progress. So with that, our first question is for Casey. Casey, does acromegaly limit you in any way?
I would say no. The only time that I really think about acromegaly, to be quite honest with you, is the 5 minutes it takes to prepare a injection at night. That 30 seconds that I have to take a pill in the morning before I head to work. I think it's been a mindset that if we can allow anything to change the way we live our life, but I've just said, you know what, this is what we do, this is how we're going to do it, and it's really just become a routine. I mean, I know I take pills in the morning, I'm going to do an injection at night, and the only time, again, I really think about acromegaly is when those things take place, and it's just become a normal routine for us, which I feel very blessed.
Great. Our next question is for Lisa. Lisa, what is something you want all acromegaly patients to know?
I think first of all is that there's a manageable condition. Like I mentioned before, the pituitary makes a lot of hormones. Sometimes they're high and sometimes they're low. If they're low, we can replace them. If they're too high, we can suppress them. So it's manageable, especially if you adhere to a treatment regimen and you have those screening tests. I think life should be great, and like Casey said, it shouldn't be something you have to think about often. On the other hand, it's not something that we want you to forget so much about that you don't come in, and so we can catch any problems that might come early.
Okay, our next question here is for Casey. What symptoms or levels do you pay close attention to or frequently discuss with your physician?
Well, I feel very, very fortunate that I've got a doctor who truly does have an invested interest in me, my family, my health, and what we do. And Lisa is fantastic and cares just as deeply as Dr. Brewer does. They're very on top of me. As a matter of fact, I every once in a while get rebuked by them that I'm not in as much as I should because they want to keep track of the blood levels. But certainly the growth hormone is what we pay the most attention to make sure that we've got that controlled and that it's at a consistent, steady level. We definitely, the thing that I feel fortunate as well, and this may sound silly, but Dr. Grua has done an enormous amount of tests on me. At 40 years old, I went and did a colonoscopy, and a lot of my buddies laughed and thought, man, you're pretty young to be doing that. But I've tried to flip it the other way and thought, I'm maybe 10 years ahead of my buddies where, they're checking my heart, they're checking different things. And so I think that to me is an advantage. I feel like I'm on a regimen that my doctors are paying very close attention to my health. And so, but certainly the growth hormone levels are what I think we pay the most attention to. And Lisa could speak to that as well. But those are the ones I think that we need to make sure are managed appropriately, consistently throughout, the years and different blood tests.
Okay, so that is helpful because our next question is for Lisa. And Lisa, what information or details are helpful for patients to track long term?
There's a few things. I think energy levels are something that are important to look at. Also, things like headaches or any other recurring symptoms that may have prompted you to get the diagnosis of acromegaly to begin with. The fatigue thing is important because thyroid is so closely tied into patients that have acromegaly. And, I think a lot of people just think, gee, am I just getting tired? Am I just getting older? Or there really could be another problem going on. That can also tie into testosterone and estrogen levels. So we like patients to keep track of that. So I would think the most important things that you can tell us is your energy level and headaches that you may be having. And we also like to watch for diabetes. Higher levels of growth hormone can certainly exacerbate diabetes or even bring it on. So we like to check those blood sugars. So if there's any symptoms of diabetes, we like to watch those too. So even if you think a health concern may not be related, be sure and talk to us about it, because we might look at a blood test a little sooner than we typically would if you'll let us know what's going on.
So our next question, I believe, is for Casey. And Casey, this is about, for those that are newly diagnosed, what is most helpful for supporting someone that is newly diagnosed?
Well, I'll refer back to when I first found out in 2002 that I had acromegaly. Lisa and Dr. Gruer were fantastic to explain to me what was going to happen and how it was going to go down, but they had never been in surgery before, hadn't had radiation and those things. And so having perspective from someone who has lived with acromegaly, has had surgery, who's going to face radiation, the regimen of pills, I just want to give them hope that, yeah, I mean, it's unfortunate, and would any of us choose to have acromegaly? Probably not. But all that being said, it's manageable, and we can live a healthy lifestyle. And, you know, there might be some tweaks here and there that we can talk to each other about, that we can take to our doctors. One thing that Dr. Grew has been great with me, and Lisa as well, they ask me a lot of questions about a lot of different things, and I think they're trying to really look at my overall health and see if there's any links to low energy or low testosterone. And so those are some of the things I've tried to share with friends that I've met along the way, and now this new friend's wife who has acromegaly is some of the signs for her that maybe she needs to talk to her doctor about. And I think she really felt comfort knowing that, you know, I'm a pretty normal guy and I've got the same disease that she has. And just being that comfort for her, I think, played a major role in her. There's still fear. I mean, who are we going to kid when someone says we're going to, you know, do a little surgery and go up through your nose and all that stuff? I mean, I don't know that any of us wouldn't have a little bit of anxiety, but knowing that we can talk to people and tell them, this is the way it's going to go, this is maybe the way you might feel, I think really, really helped them with the process. And I wish that I would have potentially had someone that could have talked specifically to me about that, knowing that they'd done it. Because, again, Dr. Grew was great and Lisa was great, but they haven't had surgery and they haven't done some of the things we do. And so being able to speak to them, having that experience, I think gave her some real hope and took away some of that anxiety.
Thank you. Lisa, our next question is for you. What are some ways that you can maintain a healthy lifestyle while managing your acromegaly?
You know, I would say, first of all, don't let it inhibit you doing the things that you love to do. Casey's a great example of that. He's still refereeing basketball. He's still out roping. He's still doing those things that he loves to do. So look at the things that you love to do and still incorporate those in your life. This shouldn't prevent you from doing that. The other thing that I would suggest that you do is really talk to your healthcare provider about if you feel any limitations and ask them what you can be doing. You know, if you want to run a marathon, you may not be able to do that in the first month or two afterwards because it takes time. And I would just encourage you to find the passions that you have and then talk to your healthcare provider about a plan for you to do that. If your joints ache, let's find out if that has something to do with it and get some coping strategies and get you out doing the things that you want to do. So I say, first of all, just don't lose your passion for the things that you love and let us help you find ways to still incorporate those into your life.
So as a follow-up to that, Lisa, do you have tips and tricks that you can share about managing a chronic condition?
You know, there's a couple of things. First of all, especially if you're new to this, just remembering is hard. I always have our patients keep a calendar. I want them to write down if they're having headaches and they can't remember how often they are. Boy, keep track of those, and maybe we'll find out that their medication's wearing off sooner than we thought it was, and maybe we can work with that. If they're having gastrointestinal problems right after they receive an injection, let's find out about that and see if we can treat you ahead of time so you don't have to have those couple of miserable days. So first of all, I would use a calendar. I would record your symptoms, and also it'll help you keep track of the medications that you're taking and help you remember. We all forget, and that's okay, but if you'll keep track of it on a calendar, it will make a huge difference. And just keeping a journal, just a one-line thing of how you felt that day, especially early on, will really help us so we can help you.
Okay, our next question, Casey, is for you. You had such an interesting story about how you became aware of acromegaly through your wife. What are some other ways that you think people can help spread awareness of acromegaly?
Well, I think that's the most interesting challenge that we face as patients who have acromegaly is we spoke in Chicago about us noticing signs with people who may have the disease and are undiagnosed and living a life with acromegaly and don't know it. The challenge for us is to figure out ways to educate and talk with people about some of the things that may be leading to acromegaly. An example being if you see a young man who, this year I refereed a guy who he's 7'6", he plays at UC Irvine, and I would bet all the money that I have that he has acromegaly or giantism. I mean, he's a mountain of a man, and he's got coarse features and all the things that say acromegaly. The difficulty for us is how do I bring that discussion up with this young man and say, have you been treated? Do you know what acromegaly is? Without having them look at me like I've lost my mind. And so I think the challenge for us is to figure out ways to continue to find ways to talk about our disease and to educate people about what acromegaly is, in hopes that somebody may hear our message or they go online and see one of these webinars and the answer to some of the questions they have would encourage them to go see a medical professional. And hopefully, we might have an opportunity to say the right things at the right time that would create an open communication with someone that we may be able to give some hope or some education to. But I think it's a really unique challenge. I don't know that the answer is one-fold, two-fold, or even three-fold. I think we got to continue to tell our stories, and I feel very blessed that we're involved with these webinars because a lot of rare diseases go unnoticed, and people are living out there in fear and don't have the answers to what's going on. So I think the more active and that we can be and the more we can communicate, talk about our disease and the positives of being treated, I think will go a long ways.